Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
The COVID storm has hit the country. We're seeing more and more patients being admitted to the hospital. There's a dearth of oxygen. To talk more about this, we're joined by Dr. Naveed Shah, who's the superintendent of Chest Diseases Hospital in Kashmir and a renowned pulmonologist. Dr. Saab, the situation is evolving. We're seeing more and more cases now. It's the second wave that has hit. You have been a COVID warrior yourself in the first wave. You observed the situation. What's the difference that you're seeing now?
Actually, we see over the last around couple of weeks, we have seen a substantial increase in the number of cases. And what we are seeing is that the virus has slightly changed its behavior. We are seeing more of young people coming to the hospitals with moderate to severe pneumonia. In the previous wave, we saw that majority of the patients who were admitted in the hospitals were above the age of 50 and those with comorbidities. But of late, we are seeing that even young people in their 30s and 40s are getting affected by the disease in a moderate to severe manner, which is putting an overload on the hospitals. If I talk about my hospital, which is the biggest hospital running COVID facilities, we are having around more than 100 beds. Each of the beds is fitted with oxygen right now, and almost all the patients who are admitted right now here in the hospital are in need of high flow oxygen. As of now, we don't have any shortage of oxygen. We have quite enough oxygen plants, and for backup we have oxygen cylinders and oxygen concentrators in case there's a shortage of oxygen. But if the number of cases increases substantially, and simultaneously the number of severe and moderate cases also will increase, which can put a lot of burden on the other hospitals which are designated as COVID hospitals.
You said that there's not much of a shortage of oxygen in Kashmir, but if we talk about the rest of the country, we're seeing in many hospitals there is actually a shortage of oxygen. There is clearly no substitute for oxygen. But in those circumstances, what should the patients really do if they are not lucky enough to find oxygen for themselves?
There are two types of oxygen delivery mechanisms. One is the oxygen bank, which needs refilling of the cylinders, which are oxygen plant. Second are the oxygen plants, which sort of manufacture oxygen out of air. So the hospitals which are having those oxygen plants won't be having any shortage of oxygen. But the places where it is run by backup cylinders, there can be a shortage of the oxygen in that part of the hospital. But if the demand increases so much, then it's advisable that all the high-risk patients who have those type of patients at home should get at least an oxygen concentrator which runs on electricity, which does not require any refilling, and they can suffice the need of their oxygen by these oxygen concentrators.
Dr. by now people know what all precautions need to be taken, but in view of this new COVID wave that seems to be very intense, what do you suggest the people to do in addition to the things that they have already been doing for the last 1 year?
I think the wave has come because of complacency, which was set among the people that probably COVID has gone. COVID is here, it was there, it is there, and it will be there for times. So we have a process of vaccination which is going on, and we have seen that the vaccination is quite effective in controlling the disease. We have seen a number of patients which got COVID positive even after the vaccination. But studies have also shown that we are also seeing that those patients which become positive after the vaccination have a milder disease. They do not progress to moderate to severe disease. So the first point is that whosoever gets a chance of vaccination should come forth and take the jab and prevent himself from contracting severe disease. It's becoming open for all above the age of 18 after 1st May, as has been announced. So I will request all of them to come forth and get vaccinated. Number two, the precautionary measures. It's known to everybody. We have been hearing it from last 1.5 years. What precautionary measures we need to take: use of masks, use of hand sanitizers, maintaining physical distance, avoiding social gatherings. So these are the things which need to be done to prevent this taking the mass coverage of patients.
So all those things that people need to stick to, but clearly you are suggesting that people should not shy away from vaccination. They should try and get themselves vaccinated if at all they get a chance, and that is clearly a good way to deal with this pandemic.
Absolutely, that's the only way. See, we have been telling from day one. Even at this point of time, we don't have any drug which is authorized or which is a definitive treatment of COVID. So we don't know the right treatment for COVID. The only thing what we have are the preventive measures and the vaccine. The vaccine, effective vaccine, can help us to prevent this outbreak of pandemic, and the waves subsequently can decrease.
Dr. Saab, I come back to the question of oxygen. We're seeing at places oxygen being stopped, people really desperately trying to get oxygen. That seems to be the biggest concern right now. How do you see the situation, and what do you suggest the people to do?
See, I would suggest first, the prevention is always better than cure. So you need to take preventive measures. Suppose if anybody has symptoms, get immediately tested and get isolated. So don't shy away from testing who has a symptom or a contact with a patient of COVID. You should immediately get himself tested and get isolated. That will break the chain, and taking preventive measures outside will also break the chain of transmission. Because what we are seeing of late, that the virulence or the infectivity of the virus is more. We are seeing right now whole of the families of patients coming positive in a short period of time. In the previous year, we used to have positive patients in the contacts of patients, but it may be one or two people from their household. But right now, we are seeing that almost the whole of the household gets positive in some period of time. So maybe the contagious nature of the virus has increased.
So the mutant strain is more deadly and it affects the younger population more. That's what you're saying.
Talking about the mutation right now, I don't have any scientific evidence of having a mutant in Kashmir, because whatever sample we have sent for testing of genomic sequencing to outside labs haven't shown any mutation right now. But practically what we are seeing, there is certainly a change in the behavior of the virus.
So clearly, it's a testing time for everybody. Everybody need to follow the protocols that have already been there and try and take care of themselves and stay away from gatherings, use masks, and also take other precautions so that they're safe from this pandemic. Thanks so much, Doctor, for speaking to us. That was Dr. Naveed Shah giving us details and telling us what exactly is the situation and how should people react to this COVID storm that seems to have hit the country right now.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.